we wrote kind of an editorial synthesizing some data that have been published by Overman, Dr. Scott Kopetz, who's also at MD Anderson. What we looked at was to see whether there could be therapies that you could add to oxaliplatin that would reduce the liver injury that is caused by oxaliplatin. So oxaliplatin is known to cause hepatic sinusoidal injury. And this is manifested by, sometimes we see reduced platelets, splenomegaly, and this is something that's seen often when we do hepatic resections of metastacectomies. So patients who have colorectal cancer, they have limited liver metastases. They have a metastacectomy of maybe 1 to 2 liver metastases, and on the pathologic sample, they see evidence of hepatic sinusoidal injury, which is due to the oxaliplatin. So what we've seen is that patients who are treated with bevacizumab in addition to the oxaliplatin, so if you're using a regimen before you go for a metastacectomy, for example, such as Folfox and bevacizumab, that actually the rates of hepatic sinusoidal injury is decreased. And we think that bevacizumab is protectant in that way against the hepatic sinusoidal injury by way of using the VEGF inhibition, interacts with the reactive oxygen species, and reduces that injury caused by oxaliplatin. So we think that's important because we know that patients who have hepatic sinusoidal injury have increased morbidity after they have liver resection with metastacectomies. So if this is an option to use in kind of a pre-operative setting, we think that would be beneficial for patients.